I'm Dr. Carter Clement from Children's Hospital of New Orleans, and in this video we're going to discuss intoeing. Intoeing is common in children. It typically does not require any treatment, including no bracing, physical therapy, or surgery. In fact, intoeing should actually be considered normal, except in very severe cases. In general, rotation is determined by three parts of the leg: the hip and thigh bone, or femur, the shin bone, or tibia, which is the larger bone of the lower leg, and the foot. Overall rotation is the sum of these parts and determines which way the feet point, as shown by these arrows. These segments can be measured separately by your doctor during the physical exam, as shown here, to determine where the intoeing is coming from. It's normal for the rotation of the leg to change as children grow. Children are typically born with femurs that twist inward, which is why some children sit in this so-called W position. Similarly, the tibia is twisted inward at very young ages. Sometimes this gives the appearance of bow legs. In some cases, the foot is also bent inward. The medical term for this is adductus. In these cases with intoeing caused by the foot, the adductus tends to straighten out very early, typically by about age 2. By age 4, the shin bone also usually straightens out. Finally, by approximately age 8, the femur has straightened out as well. As a result of this normal pattern of leg rotation, intoeing in infants is typically caused mostly by the foot's position. By contrast, intoeing in toddlers who have recently begun walking is typically caused mostly by the shape of the tibia. Lastly, intoeing in older children is usually caused predominantly by the shape of the femur. Braces are not typically needed for intoeing. In very rare cases, when the foot is turned inward and does not improve over time, braces or casting may be worth trying. As for the thigh bone and shin bone though, braces do not change the rotation, nor do they speed up the natural process of straightening out over time. Physical therapy is also not necessary for leg rotation and does not change the shape of the leg. It's worth noting that in the past, braces were used regularly for intoeing. Since then, research has taught us that braces are not effective for intoeing, but you may know adults who were treated with intoeing braces when they were children. As mentioned earlier, these are no longer used. By age 8 to 10, the leg tends to be rotated the way it will stay for life, which is usually with the toes pointing nearly straight ahead. Of course, many adults are left with toes that point either slightly inward or outward. As mentioned earlier, this is considered normal and usually doesn't cause any problems. In fact, if you watch sports closely, you may notice that many professional athletes have some obvious intoeing or outtoeing, and it clearly isn't hampering their performance. Some research has even suggested that mild intoeing may make you sprint a little faster and jump a little higher than you would with toes that point straight ahead. Intoeing is almost always painless and typically doesn't require surgery except in the most extreme cases that have failed to improve throughout childhood. In those extreme cases, we only consider surgery if leg rotation is so severe that it causes problems like pain or frequent tripping. However, frequent tripping is impossible to determine in young children because they trip and fall down so frequently just by virtue of being kids. Realistically, it can only be determined in older children and teenagers. In the rare cases when surgery is necessary, it involves cutting the bones, which we call osteotomies, and straightening them out. The cut bone may be fixed with a metal plate or a metal rod in the center of the bone. These surgeries typically require a lengthy recovery, often with 3 months to a year before returning to running and sports. In conclusion, surgery is very rarely needed for intoeing. Similarly, braces and therapy are not typically required for this treatment. For the vast majority of children, the leg rotation will typically correct on its own, and even when it doesn't, the leg's rotation usually causes no problems and never requires treatment. Thank you for listening, and if you would like more information on the topic, please visit orthokids.org.